International Midwifery. The aim of this presentation is to present how the practice of midwifery changes from country to country. We will demonstrate the diversity of the discipline through highlighting the history, education, and culture of midwives around the world.
We are going to now transition to talk about midwifery in France. Midwifery in France began in about the early 18th century when France was having a public health crisis. There was a very high incidence of maternal and infant deaths, especially in the countryside. There was a great need for skilled midwives at that time. There was a priest who lived back then, and he said he estimated about 200,000 babies who died from poor care. Angélique du Coudray came right at that time, and she became a revolutionary midwife figure for France. She saved, it's estimated, over 100,000 of babies. She trained more than 10,000 midwives. They were so busy in her practice where she was in the countryside, and later on they moved closer to the city. She said that they would be delivering about 12 babies a day. Her motto was saving babies for France. She was the first professional to make a life-size mannequin of a full-size woman body and then also the infant body as well. Later on in her practice, she became the king's midwife. In the 19th century is when the first midwifery school actually opened in 1802. And then in 1892 is when the Midwives Act of France opened, and it became an official regulated status in the country. In the 20th century is when the universities in France began holding midwifery programs. Midwifery education in France is very similar to America. You must first receive your bachelor's degree and then a master's degree. And many of the universities in France have a 3+2 program where right out of high school, an individual can apply and be accepted into the master's program right away and not have to reapply after their bachelor's. And they will complete their master's degree in 6 years and become a nurse midwife. The Conseil National l'Ordre des Sages-Femmes is the regulating council that oversees the profession. I think it's really cool to say that since 2006, the council has had all female presidents. And the profession is actually starting to appeal a lot more to the younger generation coming in now. So they're seeing an influx in students applying for the program. In France, the annual salary for a midwife is almost $86,000 a year, which comes down to about $42 an hour. Midwifery in France is very common, and it's what we call c'est la vie. It's the life and the culture there. Everyone mostly always has a midwife. It's very traditional there. Midwives in France are the main figure and responsible for childbirth. That's true for the public sectors as well as private practices as well. After birth, I found this really cool that instead of bundling up your baby and having to go to the doctor's office, every month or so or a few weeks when the baby's born, the midwives in France actually come to your house and do home visits, which I think is really cool. In France, the midwives have a major role in social policy, and they work with the national public health regulations and ensuring that patients are receiving the best care. In France, their focus is personalized care within the home, which I would love to see that trend start up in America as well, because I think that is midwifery in a nutshell. Some interesting midwifery statistics for France is that nearly 90% of the women have spontaneous vaginal deliveries are cared for by midwives. And there's only 2% of women who need to have their membranes ruptured artificially. Only 1% need episiotomies. And 76% of the women have hands-off perineum management care from their midwives. Also, I think it's important and really cool to say that their APGAR scores, any APGAR scores less than 7 is only 0.4% in France. Some interesting and fun facts about midwives in France. They are known as the sages-femmes, which means wise women, or sometimes it's referred to as the seen one. In France, midwives are highly respected. And again, about Angélique du Coudray, how she trained her midwives with these life-size mannequins and the birthing dolls. I included pictures for you to see them. And I thought it would be kind of interesting to say that they're made of fabric, stuffing, leather, wood, wicker, and she even used real pelvic bones to build a model of the lower torso. She rigged up strings and straps to make the birth canal and the perineum stretch. And she also had sponges installed on these dolls, and they would spurt liquid that would simulate the blood and the amniotic fluid at just the right moment. Her newborn baby, as you can see in the picture, it had nose and ears, mouth, tongue, hair, and it was attached to its umbilical cord. She also crafted a set of twins and attached them to a placenta. She called these contraptions of her machine, and they were used by all of her students and soon became very highly recognized. And again, this is just her revolutionary way in midwifery, starting the trend of using mannequins to teach her students. Very cool.
Now let's move on to India. The history of midwives in India starts with the Deys, who supported women throughout history. They're a very traditional type of midwife who attended to all births in their villages. Auxiliary nurse midwives were implemented in the early 20th century and currently attend 12% of the nation's births. Finally, general nurse midwives were introduced in the mid 20th century and were created as a position to increase the number of midwives in India. The education levels for the different types of midwives vary. Days, now currently known as barefoot doctors, have no formal education, and families pass knowledge down throughout the generations. Auxiliary nurse midwives go through 2 years of courses after their 12th year of school. This would be the U.S. equivalent of an associate's degree. General nurse midwives go through 3.5 to 4 years of training after their 12th year of school. This would be the U.S. equivalent of a bachelor's degree. The culture in India is largely dependent on the caste system. Days are in the lowest caste as they interact with blood and other bodily materials. In urban areas, higher caste women desire OBGYN care. In rural areas, there is a large distrust of auxiliary nurse midwives and general nurse midwives, and they often prefer day care. And days are responsible for prenatal care and education in rural villages that do not have auxiliary nurse midwives or general nurse midwives.
In the country of India today, there is a horrific morbidity, maternal morbidity and neonatal mortality rate. This has resulted from a lack of intrapartum care, and this poor intrapartum care has resulted from a lack of properly trained medical professionals and the over-medicalization of the labor and delivery process. Ultimately, India needs to respond to nearly 35 million births per year by 2030, and the need for midwives in rural settings aligns with this goal. Therefore, India has implemented a program to increase access to care and to midwives in the rural setting. Midwifery compensation in India is difficult to attain data on. However, it seems that the approximate average salary is about $15,000 per year, averaging $9.97 per hour. Additionally, it's difficult to determine exactly who pays a midwife's salary, but it's likely funded by the central government. Ultimately, midwives have to pay for their training, but the midwifery training programs are funded by the government in order to keep their doors open at this time.
The most recent statistics regarding delivery in Ghana show that 234 women die per 100,000 live births due to pregnancy-related causes. The maternal mortality ratio has actually improved from 943 in 2000 to 234 in 2023. The infant mortality rate was 28 in 2023. These two pictures are from the birthing center that I volunteered at while in Ghana. While I lived in Ghana, I had the opportunity to serve as a missionary nurse in the maternity ward, and my experience doing that was very eye-opening. I'm really encouraged to see that the Director General of the Ghana Health Services is making more strides towards implementing midwifery care for these mothers, giving them this mental support and spiritual support that they need during delivery.
The history of midwives in Ghana started with the births being attended by women who would be called traditional birth attendants. They had skill and knowledge from their predecessors who would train them to assist pregnant women. However, the colonial government and health officials started to have disdain for the native midwives and often blamed them for the really high maternal deaths in the country. This led to a movement of moving towards formal education. The transformation of midwifery practice in Ghana began in 1928 when the first maternity hospital, Accra Maternity Hospital at Korle Bu, was opened to provide maternity services and also to train midwives. The government believed that the high maternal death rate was due to the ignorance and malpractice of these native midwives. So to fulfill their goals, the government figured it was essential to replace the native midwives with midwives trained by the state in Western midwifery education and also to monitor their activities. Before a person could even apply to be placed on the roll of registered midwives or be allowed to practice, she was required then to undergo a course of training that was approved by the Board of Nursing and Midwifery, and this would last for at least 18 months. However, now midwives in Ghana, they are training in 3 or 4 year programs with their focus being in the care of women from the gestational period till birth. This is a pretty focused training surrounding women in the pregnancy state, and they don't receive much for well-rounded nursing care education. And this formal training is the same for midwives who work in more of a referral setting in Ghana compared to those who are in the lower level, like community health planning and service settings. So there is a gap in training of midwives in Ghana, which can lead to these poor health outcomes that we are seeing in the country. There's a pretty high need of women needing obstetric care, but these midwives do not have the highly skilled advanced midwifery training, which there's then this greater need for midwifery.
Although we've covered a majority of this information throughout this class, we still want to touch on it in this PowerPoint just so that we can compare midwifery in the US to these other countries internationally that we've talked about. So in the US, we do have multiple types of midwives: a certified nurse midwife, a certified midwife, a certified professional midwife, or a lay or traditional midwife. And so we're just going to look at the education, but then we're also going to talk about compensation so we can see how that differs here in the US versus those other international countries that we already discussed. So certified nurse midwives need a master's or doctoral degree in nurse midwifery, and then can ultimately make, in the US right now, they're averaging about $95,000 to $150,000 a year. A certified midwife needs a master's level in a midwifery program, but with no nursing background, but has the same scope as that certified nurse midwife. And with that schooling, their average annual compensation is about $90,000 to $110,000 a year. Next, the certified professional midwife, their education is in specialized midwifery schools or via an apprenticeship program, and they are compensated about $50,000 to $120,000 annually. And then lastly, we have the lay or traditional midwives, which they receive no formal education. Their training is done via apprenticeship or self-study, and they are compensated on average $50,000 to $100,000 annually.
A few international organizations that we thought would be helpful to mention that are working to advance midwifery care around the world. The International Confederation of Midwives is an organization that is seeking to strengthen midwifery associations and to advance the profession globally by promoting more of an autonomous approach for midwives. The core pillars of the International Confederation of Midwives is education, so promoting education, make sure they continually have access, regulation of the practice and what that may look like, and association, providing associations for these midwives to be a part of. The United Nations Population Fund. This is an organization that is seeking to strengthen midwifery education and training, as well as preparing them to deliver comprehensive care that could be sexual health, reproductive, maternal, newborn, and adolescent health care. And then the World Health Organization, they have recently established new guidelines for midwives to be the sole provider, so creating a greater sense of autonomy where they can be serving women and babies throughout pregnancy, childbirth, and the postnatal period.
After learning about international midwifery, you may be interested in broadening your horizons and going on an immersion trip. 3 types of immersion trips are cultural immersion, fieldwork, and student internships. Wombs of the World is a cultural immersion trip organization where you can learn from traditional midwives and participate in ceremonies honoring the sacred practices of birth. You can travel to multiple countries, and it is open to all birth lovers. Most famously, Doctors Without Borders is an organization in which you do fieldwork. You'd provide emergency medical aid to patients in French and Arabic-speaking countries. You'd have to hold a U.S. license and have 2 years of work history and speak French or Arabic. Finally, student internships allow students and fresh graduates to observe and provide patient care with guidance from instructors in hospitals and clinics around the globe. Work the World has locations in Africa and in Asia.